Hey everybody, Dennis Stanley here with Respiratory Sensei. Hey, do you know what is the meaning of an MI in the medical world? Well, I know you're thinking, well, of course I do, Dennis. That's myocardial infarction. But in fact, myocardial infarction is just one of the different types of MI. There are others, and we need to talk about those things. So what are they? Well, as the Japanese would say, "何ですか? 教えてください." So now we're going to talk about MIs from the perspective of electrocardiography, which are those little rhythm strips of heart tracings. And you've seen those before. We need to know those for two purposes, of course, to take care of patients, but they're also something that can show up on the NBRC exam, so we also want to know about those. There are three basic MI rhythm strips that we need to know for the exam and for real life. And so that's what we're going to look at. We're going to look at the rhythm strips, how to recognize the different types of MI, and also how to treat them. Now notice that when I say MI, or I'm saying MIs, I'm using the plural form. So what do we mean by that? Well, you know about it a little bit. It's called a myocardial what? I know you're probably thinking it's called a myocardial infarction, but that's only one of the MIs. There's also something called myocardial ischemia and myocardial injury. And we need to understand for the purpose of the exam and for taking care of patients that those are very different. Now, it's true that one can lead to the other, but each of those conditions shows up differently on the ECG waveform. We need to be able to look at that and recognize that, certainly in real life, but also for the purpose of the NBRC exam. Now, this could be something that we discover on cardiac patients as we work with them, but it's also something that we might observe for an ER patient that no one knew they had any kind of cardiac problems at all. So we need to be able to very quickly glance at an ECG waveform and recognize there is a cardiac problem. What is the problem? Well, we have three choices. It could be a myocardial infarction, it could be myocardial injury, or it could be myocardial ischemia. So let's learn about those. All right, so let's take a closer look at the three MIs. First, we have myocardial ischemia, then we have myocardial injury, and then we have myocardial infarction. Let me jump to myocardial infarction just for a moment. That's the worst thing. And this cardiac situation can progress from ischemia to injury to infarction. Infarction is when you actually have dead tissue. We'll talk about each of those in detail in just a minute, but we need to be able to understand those on the ECG waveform and how to tell the difference. But let me just give you a practical understanding of what these might be. So if I were to come up to you and were to pinch your arm, you would probably say, ow. But as soon as I let go, you're probably fine. That's a good example of myocardial ischemia. This is when the heart is not getting enough oxygen. We'll talk more about that in just a minute. And the heart is going to have some pain. It's going to tell you that, hey, that hurts when I don't get enough oxygen. But then if we advance to injury, well, that's me like pinching you and you say, ow, and I pinch you long enough that when I let go, there's a bruise there. And not only do you have a bruise, but it might be there for several weeks. Might change discoloration here and there and color differently, but eventually it will heal. And that's just like injury on the heart. We can't injure our heart, but eventually that it will heal. But if I were to pinch your arm so hard that I cut off all the blood circulation to your lower arm for the rest of your life, then that's going to be permanently dead tissue. You might have to have your arm amputated because you don't have an arm anymore. And so that's equivalent to infarction. That means there's tissue in the heart that has died and is not coming back. But let's take a closer look at each one of those. Oh, and I almost forgot one more thing. This is part of a 3-part video series, so be sure to subscribe so you don't miss the other 2 that are going to come out in the coming days. So the next video is going to be on ischemia. We're going to look at the rhythm strip and how to identify that, and then we're going to do another video on injury and infarction, look at those rhythms on an ECG waveform so you know how to identify them when you see them. Be sure to subscribe, like, don't forget, we'll see you later.